And you can always type in your questions or unmute yourself. So
Yeah, so fire away.
Hey, hey, Greg.
Hey,
It's Robin.
hey, Robin.
Hi.
How are you?
Questions. I'm good. I'm super good. Actually, a friend of mine is going to be at your workshop this weekend. Her name's Mandy. So
Oh, tremendous.
I'm really excited. She's gone through a lot, surgeries and stuff. She's a nurse. She's wonderful. So I'm really happy she'll be there.
We were looking at the schedule, finishing up the schedule for the end of the year, through the end of the year. And we were, usually I do the schedule the whole year in January. And, I know everything where I'm going to be, but with COVID, all that's been out the door. And so we were looking at it, and we keep looking at, like, when are we going to make it out to Maui? A little class action or recon. Yeah. So we're thinking maybe in November. We're shooting for November.
Great. That's a lovely time to come.
Yeah.
So here's the question. I just heard from a friend that her husband has throat cancer.
Okay.
And he's getting chemo. I know you probably get tired of the same questions over and over.
No, it's okay.
Yeah. He's getting chemo. He just started chemo and radiation on his throat. And I just wondered if you have.
Yeah. So now that we've done the Vital Center thing and everything, I'm a little better equipped to answer some of these kinds of questions. And so first, let me address, was he a smoker?
I don't believe so.
Okay, so my guess is he had long-term reflux or indigestion, heartburn, things like that.
I think he's really pissed. He's in a lawsuit that a car accident lawsuit that he's getting really creamed in. It's really a bad situation. He feels like a victim. He's like a powerful guy that is the head of he's like a producer, Hollywood ad agency. He's big.
Yeah, I hear you. Yeah.
And he feels victimized. He feels totally victimized.
Hey, I hear you. I've been there. It's not pleasant. You're doing everything right, and still you have to deal with.
Right. He was hit, and he's being being charged. Basically, his company's getting the hit on it.
It's the thing. They look for loopholes and angles.
Right. This is such a bizarre. It's bizarre that lawyers, everybody just has never seen anything like this.
Yeah. And so, so he's in the chemo.
He just had his first chemo yesterday. He's getting radiation every day.
He's getting radiation on his throat. Okay, so you got multiple things that you're looking at. They've already done the surgery for the chemo, or they're doing the chemo first?
I think they're doing the chemo first. I don't even know. Apparently it's a good kind of cancer. It's got a good treatment.
Yeah.
But
there's some cancers they have down, how to treat it. And so, okay. I actually kind of like that the chemo is first, because you get a reduction of growth. It's easier to get cleaner borders when they're going through and getting it. And do we know, did he say well-defined borders or poorly defined borders?
Oh, I can ask.
You don't know. I would be curious, because that tells me if it's super inflammatory or not.
Okay.
And so the best thing that you can do, and I don't know how much the person will do or not, but for the chemo, I really like to use Greenland moss. I think that's really super helpful in treating the liver and helping to reduce the effects. I usually don't start it right off the bat. I let him get kind of through the chemo a little bit. The radiation you can start treating immediately. The radiation, you can do versions of lavender and aloe vera gel. I usually use lavender and helichrysum put together, and then put it on a gel that he can apply to the throat multiple times a day. I usually put them on the black cumin and the galbanum, how we had Yarrow use.
Yeah.
Just because pain. But here's the thing, and I think I've said this, but I'm not sure. or it's been a while. But like when they're going through chemo, I usually like to have them refrain from eating certain things. And the issue is some of these things help the cancer to grow. And some of it is as your body goes through and processes the chemo, your body kind of starts to behave different. And so one is reduction of meat. And if he can go off meat for like probably 3 months, it's not forever. I mean, I usually repeat
Okay.
this to the person multiple times. It's not forever. It is through this treatment.
Okay.
So going off meat. God, it's been so long. So meat, like nuts, like especially peanuts, and no corn, no soy.
Okay.
The corn is a kind of a hard thing. It's not just corn, but I mean, there's like corn syrup and everything. I mean, he doesn't have to be fanatical about it, but I would just
Okay.
say reduce it, because the potential is the body is getting a little toxic with the chemo. And one in, I think, I can't remember if it's 1 in 18 or 1 in 20, don't have an enzyme in their liver to process the chemo. And if that's the case, there's not really a way to find out until it happens. They'll have a massive allergic reaction. And so one of the things that I like to do is foods that really like kind of lean towards being something of the allergic reaction. So corn, peanuts, I usually even do shellfish, but that kind of falls within the meat thing, but I emphasize also shellfish.
Okay.
I usually, and again, it's just until this is over. Like
Okay.
once he's done with chemo, he can have a steak with a big bowl of corn.
Okay.
Watch it out with some peanuts. Like that does not matter. We just want to
Okay.
get him through the tough time, right? And so lavender and helichrysum with aloe vera gel, like on the site, it will help keep the burn down and keep the pain down. The galbanum and black cumin internally will keep the inflammation down and won't affect the chemo and keep the body, because the body's going to be agitated from all the things going on. And, pain mechanisms are going to go up high because it's the body trying to say, hey, something's going on, stop this. So you're just wanting to kind of calm that down. So the galbanum will really help with that. Once he's off the chemo, I would do the Greenland moss. As far as the cancer is concerned, one of the best things he can do is, even if it's just not following the patterns, but breathe through all 11 of the Vital Center kit. Like if you
Okay.
look at somebody with a chronic health issue, especially like cancer or leukemia or something, their vital centers are just way, 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 way super agitated. And so
That's after the chemo.
he could start doing it right now. Like he can start
Okay.
doing it right here, right now. And, he doesn't even have to have very much. So if you already have the kit, you can make like those little 2 ml bottles.
Uh-huh.
Just put like 10 drops in each one of them and ship it
Okay.
off to him and just tell him, this is the order, inhale him in this order. And, it will make him probably feel better. And then the other thing is it will potentially slow the growth of the cancer. And so those cases where I did get the cancer to go away, we were doing versions of this with, healing, of course. It wasn't just the oils, but we got
Right.
a big reduction. Other oils that can reduce cancer growths, if it's inflammatory, yarrow is really good. If not, pine needles are really good for offsetting the effects of that. And a new one that I was discussing with one of my peers was yuzu. Yuzu is actually good for that. It helps to take the agitation out of the autonomic nervous system, specifically sympathetic nervous system, which is fight, flight, or freeze.
Okay.
It does have some anti-tumor type properties to it. I mean, none of it's going to make it completely go away. You're just trying to buy a reduction of growth. You know, you're just trying to reduce it as much as you can. You hope for a miracle, but you just kind of stay practical about, like, if you just kind of keep taking this, the doctor's doing what they're doing. Good shot at it. You know, throat
And
cancer is one of the ones they're actually pretty good at treating.
And the Greenland moss, is that internally, is that externally? Is
Yeah,
that smelling?
no, that would be internal as well. So the black cumin, the galbanum, and the Greenland moss would all be internal, all separately. The Greenland moss, he can wait. He's probably doing like a 6 or 8 week cycle. So you could have him wait. I mean, sometimes they do 3 or 4 weeks if it's, you know, prior.
Okay,
Yeah.
all
And
right.
so, you know, as soon as he's off the chemo, you can start, you know, pumping 2-3 drops of that into him a day. So here's the other big issue with being on chemo. And again, like when I had cancer patients, I always had this talk. And, you know, I can't remember what I've said to you guys about some of these things, but he's going to lose his appetite. I mean, it's just mechanics. And so before he loses his appetite, he has to come up with a strategy of how he's going to get calories in. Because the thing with cancer is, most people, when they have cancer, they don't die from cancer, they die from malnutrition.
Right.
And so I don't care if it's milkshakes, I don't care if it's, you know, blended up, whatever. Like, he just needs to get calories in. I mean, it's the whole idea, like when, you know, you're little and you were sick and the doctor said, go home and drink 7-Up and eat soda crackers, or, you know, whatever crackers. It basically, you're getting sugar and carbs in you, sugar, carbs, and some fat. And it's basically, if he likes smoothies, because he's probably not going to want, like, you're going to have him say like, well, nothing really tastes good to me. Yeah, like, that's why, even if he has to drink his calories, like a smoothie, a milkshake, 3 or 4 sodas, and a handful of crackers, just he needs to get calories every day.
Okay.
Like, really emphasize that to him, because a lot of times what happens, they'll go, well, but I don't have an appetite. And, you know, then 5 or 6 days goes by and they haven't eaten.
All right. Got it. Thank you so much.
Yeah, you're so welcome.
Really appreciate that.
Yeah. Keep me posted. I am in the process of writing something up on just like parameters of how to treat, you know, or support people going through treatment of cancer. And, you know, this is basically the gist of it.
Okay.
You know, it's more about, you know, getting the calories in, and you know, ways of treating the after effect of some of the treatments. Chemo has gotten a lot better. I mean, 20-25 years ago, chemo is usually what killed people.
Right.
Now,
I know.
and these days it's still bad, but cancer does things to the body that people don't realize as well. And, you know, I always tell people it's a bar fight. This isn't like trying to nourish your body and like, hey, we'll nurse it into a case of homeostasis and it will heal itself. It's a bar fight. It's an organism that is changing your physiology to survive. It's not that your body's out of sync. You actually have something with consciousness, like a virus. Viruses are the same way, where it's actively turning things on and off in your body to survive.
Got it.
You know, so it is just a full-on bar fight.
Wow. All right. That's a good image.
Yeah. I mean, there's a couple of things, that and really severe viral infections are the only times I say that. Everything else, you know, you try to nudge the body back into a place where it can heal. And that too, but going after that cancer is, I mean, there's no being passive about it.
Okay.
The only time it's passive is in men, prostate cancer. Prostate cancer, if they're later in age, a lot of times something else takes them out. You know, if they're within 10 years of kind of a long life, you kind of let it ride.
Okay.
Yeah.
Well, thank you so much. I so appreciate your wealth of knowledge. It's kind of
Yeah.
mind blowing.
I don't know. I don't know that it's a wealth of knowledge. It's just a lot of experience because I'm old.
Yeah. All right. Well, thank you so much. And thank
You're
you
so
for
welcome.
Saturday. It was amazing.
Oh, good. I'm
Utterly
glad you enjoyed it.
amazing. Yeah.
Go ahead, Kathy.
I have a couple of questions because I haven't been able to be on these for a couple of weeks. First of all, I'm in a course this weekend and I'm really excited about
Oh,
that.
tremendous. Yeah.
First of all,
You're in Florida.
heart, opening the heart, this, is
Right.
that 26th? Yeah.
Yeah.
Okay. First of all, I wasn't in this class, but after the class, some people were talking about the poplar balsam spray.
Oh,
And it's very costly to order the oil. So I thought I'll try that, but I don't know how to use it. Or does it have a shelf life? Like, will it expire?
No shelf life. The only thing that would cause the shelf life is with the poplar balsam, we put oil in it and we also used hydrosol. And so the water a lot of times does have a shelf life of maybe a couple of years. But I added enough alcohol to it that the shelf life is probably 10 years or 12 years or something.
Okay, so when would I use it? I just got it because you talk so highly of poplar balsam and it's a little costly for me. So I thought, let me order the spray.
Well, the spray is a softer way of doing it, like you said. And so you could, like if you're doing some protocol that draws upon poplar balsam, you could spray a little bit in your hand and then smell it. You are getting some of the effect that way. But the poplar balsam, you could just spray down your body, like like point it to your body like this, and you could spray into some of the energy centers. It's very good for reducing stress and trauma. Stress and trauma. And so very good psychological healer, very good for keeping the energy moving in the body and the limbs. It has a very strong cleansing effect. So we'll keep energy moving out of the body that's either used up or low vibration, which is another way of saying potentially energy that would cause disease.
Okay. And then another thing I've been wanting to ask for a long time is I'm a nose breather. So, and I meditate, you breathe, watch your breath, breathe in and out through your nose, but most all protocols, you inhale and then you breathe out through your mouth. So is that pretty important? And I should consistently.
Well, if you breathe out through your nose, you're not doing anything wrong. It's just that you're trying to get some of the chemistry of the plant. When you smell those molecules, they're getting into your respiratory tract. And so breathing out through the nose, you're potentially breathing some of it back out. So, when it happens, I catch myself doing it too. It's not horrible, but it's most effective in through the nose, out through the mouth.
Well, it's funny, after all this time of attending classes and such, I find it most natural to do it out of the mouth. But I was always kind of curious, but I have been doing it that way. It seems.
Yeah. There's definitely some meditations where you would not do that. Like when you're doing awareness on the tip of your nose, or you're just doing things where you're paying attention to your breath, or some mindful meditations. Everything would be through the nose, and so you're just switching gears a little bit.
Okay, it makes sense. And I actually, a stress reducing thing one time said, you breathe in through your nose and breathe out through your mouth, kind of to, relieve stress. It's kind of a technique for that, regardless of oils. So. Yeah,
regardless of oils, if you do long, slow abdominal breathing, in through your nose, you're expanding your belly. So you're doing like lower abdominal breathing or just abdominal breathing. And you do it over a period of time, it does affect your stress response. It reduces the agitation a little bit of the stress that's already happened. But you'll notice if you do it every day, even if it's just like 12 breaths, if you do it every day for like 30 days, at the end of the 30 days, you'll notice that your response to stressful stimuli is significantly reduced. Like it still will be stressful, but you won't go into automatic behavior or panic mode. You'll just go, oh, this is upsetting, this is agitating, but you'll still be able to kind of like process it. And sometimes a little bit more. I've had some people where it took 60 or 90 days, but they had crazy stressful jobs. And so, yeah, I mean, it's
Is
good
that
for,
still breathing out of the mouth in that particular technique?
I would do that out of the
Yeah.
mouth.
I saw it one time that way, so.
Yeah, yeah. I would do it out of the mouth. That's the way I was taught, many,
Mhm.
many years ago. Yeah.
No, I saw that somewhere else regardless of the oils, but then it came up a lot in the oils,
Mhm.
so I kind of wanted to make that connection.
Mhm.
And another thing that has been come up a little bit, and it might have been one in the brain class or one of them I took, is I have that facial, I don't know if you remember me, but I have the trigeminal neuralgia facial pain.
Oh yeah, I totally remember you.
Yeah.
Yeah.
And sometimes I've had the idea lately that almost like my body, it's a memory thing in addition to a physical pain. Does that make sense? It's like, I
Could be.
almost am like, I've had it for over 20 years. So it's almost like
Yeah.
I prepare for the pain. I mean, sometimes it goes away or it almost does. I take medicine for it.
Mhm.
But I've also suspected sometimes it's almost like I'm ready for it and like a memory instinct. So I was just going to ask you about that.
Yeah, so something with that, I do have a thing, it's in the sleep class.
I took the sleep class or most
Yeah.
of it,
Let me go through my notes and find what that is. It's not quite muscle memory, but it is like a memory of sorts. You're right. It's a neurological memory. And there is ways of trying to flush that out and see if that works. I would say also probably because of all the masks or whatever, but seeing more like sinus related issues, and I'm seeing more trigeminal neuralgia actually in the last couple of years. And so, it could be coincidence, but we're going to put a little bit more effort in trying to come up with new ways of treating trigeminal neuralgia.
Yeah, I mean, it's a real physical thing. Don't get me wrong.
Yeah,
Sometimes
very,
I
very
wonder
physical.
if I've been dealing with it for so long that there isn't a more complicated link to body or mental memory. Also,
Yeah,
I don't know, the thought just came up.
because the nerves have so much to play in like facial expression and tied to emotion and things like that. It's a complicated area to treat, because there's, like you said, there's potential like neurological memory issues in the face. And
Yeah.
so, I did this thing like this is many, many, many years ago, but we were doing just we weren't doing like a study, but we were just doing like an exploration. And we were looking at different ways that we could quickly impact self-esteem in an individual. And one of the things, like I laugh now, but like it makes sense, is treating the face, treating the face and the nerves in the face, and taking some of the tension out of the face. And we noticed through these questionnaires that we used for in psychology, and there was a noticeable improvement in self-esteem. And so we don't really think about it like that. And I don't think this issue is tied to that, but it just showed how much we feel about ourselves is tied to some of our emotions. And if we shift some of our physiology, that the emotions actually shift and change. I would say that is probably tied to physiological emotions, but it was an interesting thing.
I think I had one other. Oh, what's been recommended to me lately, and I've been seeing a variety of people for opinion, is a tongue release. I mean, it's not related to oils necessarily, but do you have any information about, because they do actually do surgery to release the short tongue or tongue release?
Yeah. So we used to do that in manual manipulation.
Mhm.
And so one of the things that we would do is we'd go through and work the muscles of the jaw and do the gum line all the way around. And then myself and this osteopath, which God, I feel bad, I can never remember this guy's name. But we would basically have the person sit up, and we would do manipulations on the tongue, like using the tongue and then driving it back and side and taking some of the tension out of the tongue. And it had some impact on different variation of issues with tension in the head. You know, some of it were car accident victims, but a lot of what we were treating with that was head injuries. We were treating people with various head injuries. And the thing with that is there's no like protocol that you can say like, oh, this is the thing you do for head injuries, because every head injury is just super unique. And so one of the things that we were playing with was doing a lot of manipulation of the jaw, because a lot of people had like frontal injuries. And so the tongue release was something that was done. I haven't heard of it surgically being done for trigeminal neuralgia, but yeah,
Well,
I wonder if
what
we
do you
can
think-
find somebody who can do that manual release for you on your tongue. I mean, nobody was teaching it. We were just basically kind of creating a technique, and we got it kind of down. But any good like neuromuscular therapist could probably do it. It doesn't take very many sessions too. It's not like you have to keep doing it over and over again. Like if it works, it just worked.
Yeah, well, I mean, obviously surgery is something you can't reverse, so I'm a little hesitant, but my
Yeah, especially
holistic-
with that.
Yeah,
Especially
my
with that,
holistic-
because, yeah.
my holistic dentist feels that it's a next step to creating my bite, which he feels is causing the pressure on my nerve. But I mean, there's no way of knowing for sure if that's it. And then you have an irreversible surgery. So I'm just
Yeah.
curious.
Do you have sleep apnea?
I do. And that's the other thing it's supposed to help with. A mild case. I've been diagnosed with mild sleep apnea, but
Have you done the thing where you just like breathe, hiss up for long periods of time, like 20, 25 inhalations at night before you go to bed?
no, I would.
Well,
though.
let's have you do that. And
Okay.
one of the ideas is like taking the tension out of the diaphragm, which allows the muscles, and that would include the tongue and things of the throat, to relax more.
Okay.
And you know, you'll need to do it kind of daily for like at least 2 weeks, but I'd say 30 days would be a better look at it. But you should start noticing a difference almost the first night.
So 20 inhalation basically before I go, right before I'm like ready
Yeah,
to go to
You
bed.
can just lay down in bed and just sit and just take long, slow, deep breaths. And as you start to kind of get sleepy, just set the bottle down and just be done with it.
Does it matter if I lay down or I could just set up with, against my pillow?
You could lay down. Excuse me. I find that laying down, sometimes it allows the diaphragm to relax more.
Okay,
Yeah,
great. I'll definitely try.
but whatever's comfortable. Like,
Yeah.
I don't know that it's massive, but when I'm releasing my diaphragm, I usually lay down.
No, I'm ready to try anything, as you
Yeah.
know. It's just like,
Yeah.
okay.
Yeah.
Thank you so
Keep-
much.
Keep me posted on that though.
Okay. About 20 inhalations, you said?
Yeah, 20, 25,
Okay.
somewhere in there.
There were a couple people making mention that the cranial sacral, I don't know what
Mhm.
level, they do tongue.
Oh, I didn't know
mouth
that.
Stuff.
Yeah, yeah.
At least.
Yeah, I'm under the care of, I just found a new one I went to one time, and I have a follow-up that we think could do something like this. And I have seen a lot of cranial therapy. Imagine 20 years, I've done a lot, but
Right.
I have a new cranial therapist that I'm pursuing because of the tongue release situation. So before surgery, I mean, surgery, I don't go into.
Yeah.
probably.
Yeah.
What oil recommendations would you use to keep triggers and mosquitoes away?
Probably the best bet would be just the good old fashioned citronella. Citronella. Tea tree sometimes works, peppermint sometimes works, eucalyptus sometimes works, but man, for insects, I usually go citronella. We have it, we don't put it on the site, but it's really cheap. It's really super, super cheap. And so you can make really strong like sprays and spray down. It's what I used to use when I was working on the ranch, and we'd get the biting flies and things like that. And I'd spray the animals down, and it worked really, really well. They don't like stinky things where I was working, the animals. When I would pull that bottle out, they'd come running over. So you knew it worked. Anything else, if I put anything else in that bottle and it didn't produce a result, they'd have nothing to do with it. But yeah, ticks, peppermint works. I mean, there's a few things that works, but peppermint works. But those kinds of things, citronella, you can just email us, and like a 15 ml bottle is like probably, what did we say, like $7 or $8 or something. It's really cheap. Yeah.
Megan?
Hey there.
Hey.
Can you hear me okay?
Mhm.
Great. A couple questions for you. I have a client that is soon approaching getting a surgery of a hysterectomy and having a bladder lift. I'm obviously going to be doing energy healings on her, but I was curious if you had any recommendations for before surgery or after surgery. I'm sure that her hormones are going to be affected, obviously.
So before surgery, whatever you do, like it should stop like within 48 hours of the surgery. Whatever she's
Okay.
doing, vitamins, herbs, oils, whatever it is. Medication she's probably discussed with her doctor. We just don't want to complicate any sort of bleeding or anything like that. And so prior, I mean, she could start using Vitex prior. Vitex is what I would put her on after the fact. After the surgery part, the black cumin and the galbanum internally, separately, that would work really super well, help her to recover faster. If there's any sort of internal scar tissue, black cumin may help, helichrysum internally may help. If it's close to the surface, you could do compresses. But my guess, the compresses won't penetrate deep enough. And so the other thing that you could use that is not an essential oil after the surgery, if there's some scar tissue, which is basically a fancy way of saying fascial lesions. It's like tightness, or like how you get a knot in your muscle, but it's not a muscle, it's just connective tissue. And so that's a lot of times what the scar tissue is. MSM internally would break that up. And so the Vitex would be the hormonal balancing. You can put it on Vitex, and you can also put it on lemon verbena. Both would be to balance out hormones. Lemon verbena would be taken internally, and the Vitex like a drop or two, and she could just rub it on her temples.
Could she do both Vitex and lemon, or would that be overkill?
Yeah. One's internal, the lemon verbena would be internal, and the Vitex would be on the temples, but she could do them both. The verbena would help to balance the overall endocrine system, and then Vitex would be specific to the hormones associated with the sex organs.
And when you mentioned the black cumin and the galbanum, and you said separately, what do you mean?
Internal, like a drop or two, like probably 2 drops each, like in some water.
But they need to be taken at different times?
No, it's like a couple minutes apart.
Okay.
Yeah.
And that kind of leads me into, so with my fibroid surgery that I had in November, I can tell that I have scar tissue there. There's more of a mass that's there. It could be my imagination. It's hard to kind of
Does it feel close
look
to the
at yourself.
surface? Feel close to the surface, or it feels deep?
It feels like it's part of the uterus.
Okay, so again, I'd start taking black cumin internally, like 2 or 3 drops a day, and then I would augment that with MSM.
Does that stand for something?
It's a type of sulfur.
Okay.
And you get it through the health food store. It's real super easy to get.
Is there a
Like pretty much,
quantity?
I would double the dosage that they say. The maximum dosage, I would just double it. You know, the dosages on the bottle are like a maintenance dosage. They're not necessarily always a therapeutic dosage. And so here you'd want more therapeutic dosage. You're not trying to treat like arthritis and something. You're trying to break down the scar tissue. So
How long would you recommend the MSM?
until the scar feels better, you know, the tension area feels better. Usually it's like 60, 90 days. It's not a forever thing. You know, I had one patient, I think we had her take it for 2 years, but she had I can't remember, like 6 or 7 surgeries on her stomach, like abdomen. And she just was full of scar tissue. And so that was the maximum I think I've ever used MSM to treat scar tissue.
Do you have any recommendations for strengthening the bladder?
Strengthening the bladder, like frequency of urination or?
Well, she's getting, so it's lowered, so she's getting a lift. So after that, I guess, well, both, because I have another client
Yeah,
that needs frequent
it's-
frequency.
Yeah, the thing with the lift is actually going to probably correct a lot of her discomfort. Those lifts are very, very helpful. They might have to have her do, like, I think they give them some exercises if I remember right. It's been about 4 or 5 years since I've treated somebody with this. So I want to say they had them do Kegels.
Yeah, it's to strengthen the pelvic floor.
Right. Yeah, because the pelvic floor is a big issue for them.
Mhm.
Yeah.
And do you have any recommendations for frequency? That's for another.
So
client?
frequency, especially when it's frequency with very little elimination, a lot of times that's a autonomic nervous system issue. And so I would use like the ANS support. I would use Yuzu. I would use even marjoram. You know, the marjoram they could inhale. The Yuzu or the ANS support, I would say they probably need to take internally.
And if it is frequent and there's always urination, would it be the same?
It probably would be the same just to make sure, but then I start looking for other reasons. I mean, it could be that they have something that's acting as a diuretic, you know, be it in a medication or an herb or, you know, oil that they're using. And sometimes if there's none of that and there's frequency, then, you know, you kind of want to start looking at, is there a kidney issue or a bladder issue? But one of the exercises can be just to not urinate when you feel the need and relax through it so that the urgency kind of goes away, and then pee when you feel it's time.
Okay, great.
Yeah.
The last bit, I don't know, it might be a Pandora's box, but self-worth and feeling worthy. You have any protocol?
Yeah, that's a big Pandora's box.
Mhm.
Self-worth and being worthy. Let's see.
Or even a class, just a
Yeah,
direction.
I was actually thinking of classes.
The relationship class has it.
Yeah, the
Self-worth,
relation.
self-love.
Yeah, the relationship
thank you.
class has it in it.
It doesn't say it's specifically what it's doing, but if you want to know what's in
I would also say, you know, we haven't taught this class yet, but it will be in November. But you know, in the chakra classes, the sex chakra.
Perfect.
Yeah. It's like the second weekend of, I can tell you. I mean, you can just share the notes with her, but
That'd be better.
yeah. It is the 13th and 14th of November.
Well, I will go sign up for that. Thank you so much.
You're so welcome.
Hey, Greg.
Hey.
Hey, it's Tracy. So things like taking lemon internally, does that make the body more alkaline? And is there anything that is,
Potentially.
okay. Like I'm trying to make this body more alkaline, so I'm trying to figure
But
out.
it potentially can help to regulate mineral levels in the body. It can help to alkalize. It also thins the blood a little bit. And so in a way, you know, sometimes the blood gets too viscous, either through not enough water, or there can be a little bit of clotting issue, or cholesterol. And it helps in all of those. And so it does make the blood like a more appropriate viscosity.
Okay, is there anything else that you would suggest?
For alkalizing the body, or what are you trying to do?
Yeah, my body's just too acidic, and
And you've done it with pH, the litmus paper?
I haven't, but I know it is.
Okay.
I've done it before, and it's this same kind of thing.
I think like opening up the breath and the chest is always good for alkalizing.
Okay,
Yeah.
thank you.
You know, like long, slow, deep breaths, a little bit of a pause, you know, the abdominal breathing. And then if you're going to do that, especially specifically for alkalizing, I would use the hyssop decumbens,
Okay,
you know, rather than regular hyssop.
okay, that sounds good. Thank you.
Yeah, it helps to oxygenate a little bit better.
Okay. Thank you.
You're so welcome.
Earlier, you were mentioning the order of the vital centers and going in the proper order, I guess.
Yeah, it's the order in the class.
Okay, I wanted to make sure of that.
Tracy, one more thing.
Yes,
Are you retaining fluid?
yes.
Um,
And I've got sinus stuff, and
so you got some stress stuff, and is it allergies or stress?
well, stress, but I also have allergies. This is the allergy season, you know.
Yeah. Okay. So you're doing things to treat the allergies, or
You know, not like I should be.
okay,
I take
So,
Sudafed, and
right.
you know, because
Still open up the, like, even if it's just inhaling rosemary or something, or the sinus support, or you know, something like that to open up that. But I would say that some of the symptoms you're probably associating with being acidic is fluid retention. And so I would say, let's put you on something that is the body a little achy.
yes, yes.
Yeah.
And
So mhm.
when I drink, like, you know, I like the Waterloos that are just like seltzer stuff. When I drink them, I belch a lot. So that's why I thought it would be.
Oh, that's just the carbonated water. I mean, it might mean a little bit of something, but let's have you do this. You have sandalwood?
No, I have sandalwood and saffron combined.
Oh.
Apparently, I have to get sandalwood because that's the second time in 3
Yeah.
days you told me to use it.
Take in 4 or 5 drops of sandalwood, will change how your body feels. It's a venous decongestant. You know, it cleans up the veins. It's a lymphatic decongestant, and it helps remove blockages. And it is a diuretic. It will make you pee,
Okay,
probably more than anything else.
I will go order some now.
Yeah. Like I have to be careful if I take sandalwood. If I take it too late in the day, I'm up every couple hours peeing all night.
Okay.
So be aware when you
Yeah,
take it.
take it in the morning.
Yeah. Gotcha.
Because you know, you'll drink water and your body will process it, and you'll pee multiple times a day, but you're peeing out some of the fluid that's not being picked up by the lymphatic system.
Okay.
So,
That's good. Thank you.
yeah.
It also could just be it's summertime in Alabama.
True.
And
Really.
Yeah, no joke.
yeah,
So this is the other thing, like on that vein, since you bring that up, are you getting sweaty?
yeah, a little
Like when
bit.
it's like when it's hot and you should be sweating, are you sweating or no?
Yeah, probably not as much as I should be, but
Okay, I would take a helichrysum bath.
Ooh.
okay. Wow. Okay.
The helichrysum bath will, you know, if you can't do the bath, just rub helichrysum like on all parts of your body, like so liniment or something. But one of the things that can cause the fluid retention and back up the lymphatic system is the skin itself gets congested, and you're not eliminating like you should through perspiration. And so the body gets a little toxic, you know, and part of how the lungs detoxify is through the skin.
So how is helichrysum different than taking a parsley bath? Because I did that this morning.
That stimulates the circulation and stimulates the whole lymphatic function that's associated with the skin. But the helichrysum is specific for the skin congestion. Like it's basically anything that it has a strong diaphoretic property. So milfoil, helichrysum. There's been times I've used ginger, but I like helichrysum better.
Okay. Thank you so much.
Yeah.
Is the free radicals blend for inhalation only, or can you take a couple drops internal?
Mostly taken internally. Yeah.
Which sandalwood would you use for lymphatic systems?
Oh, either one, golden or regular. I mean, yeah, for that it's the same.
What would the mixture be for the citronella, and what and how many drops?
I usually mix it into alcohol. You can add a little bit of water, but I mean, I do about 40 drops per ounce of alcohol. Like I make it really super strong, and then I just spray it down. You know, either in a house, a place, the patio, an animal, yourself. Spray yourself down.
So somebody asked me, what was I talking about with the citronella? The citronella Greg was recommending for the bugs question from earlier. And he said citronella is number one, but you know, tea tree, peppermint, eucalyptus, those could all be good. And uke, whenever I write uke, I am saying eucalyptus, and frank is frankincense for you guys. Yes, any sandalwood, we got that. Is it lovage leaf or lovage root to take internally with juniper for kidney cleanse?
Either one. Root's a little bit stronger, but also a lot more mud. So the leaf, if it's not a super critical thing, I would just use the leaf, to be honest with
And go ahead, Letty.
you. Okay, Letty.
Hi, how are y'all doing?
Doing good.
Excited I'm gonna get y'all see y'all.
Yeah, gonna see you.
It
in the
always
studio.
seems like it's forever, but it's actually really hasn't been that long. I was mentioning to Channing, I was like, oh my God, it feels like it's forever when I don't see y'all.
You're just
Um,
gonna have to go on tour with us.
Right? That would be lovely. A quick question. Now, what
Mhm.
about when it's excessive perspiration? Like,
Cypress for that.
okay,
Yeah,
so,
that's the flip side of it. It's, cypress and also sage.
okay, so I noticed that you have the Spanish sage on the list, right? But because you do have it for excessive perspiration under the earth healing booklet. But is that for the whole body, or what if it's just happening under the underarms? Is there a difference?
You could still use the sage, but usually when it's like palms, soles of the feet, or underarms, sometimes cypress just by itself will knock it out.
Okay,
Yeah, and like with the cypress, I usually have them put it on topically and take a few drops internally every day. With the sage, I usually just have them do it topically.
topically, okay.
Yeah.
So if it's happening like just in the underarms, like then
Yeah.
apply it there?
Yeah, so like take like a little bit of a lotion or something and put several drops of the sage on and then rub it together and then rub it under each armpit like at night when you go to bed.
Sage or cypress?
If she's using the sage, do the sage that way.
Yeah.
I mean, you can do cypress that way as well, but cypress, I usually have them do it more internal. What you could do is do cypress internal and do sage topical.
Okay, and then I also, because this is happening to my daughter, I also did run her really quick by just one of the lymphatic things that you have. That's just like a couple, like 4 different oils. Like
Mhm.
I think it's like the skin was cafe mocha,
Right.
lymphatic blend, chakra cleanser, and then there was one other. I just had her like just inhale all those, but I
Uh-huh.
haven't heard back from her to see if she's
Yeah.
she's seen a difference or not. But we'll check.
That should be helpful. And then the other thing that we have people do sometimes with that issue is, there's the excessive amount of perspiration, but the sage will also help to reduce some of the odor like that comes out. And if the odor is real strong, you can definitely use the sage, but have them drink chlorophyll and water.
Mhm.
And the chlorophyll will change the scent of a person very, very quickly. Like how much should we put in? Like a tablespoon?
Oh, probably a couple tablespoons.
Like around here, we'll use a couple tablespoons and a big glass of water. Then, stir it up and then just, drink it like you would your normal water. And like in a few days, it kind of shifts things.
Yeah, give it at least 3 to 5 days.
Yeah. So like, 5 days to a week, maybe it will shift things.
Okay, so just pretty much anything at like the grocery store or the like a GNC.
GNC, yeah.
Liquid chlorophylls, there's a couple brands.
Yeah.
I mean,
Which one do we use?
mostly good. I mean, I think the one we have right now is just Nature's Way, so.
So,
Okay.
Nature's Way or just anything liquid.
Okay, alrighty. Thank you so much.
You're so
And I just printed the booklets just right now. I was like at school and I just, luckily I made it back on time to kind of post patterns because I was like worried about that. It's like, I don't know if I'm gonna make it on time. But so I printed the ones for today and then also for the vital centers. I did 15 of those. Is that gonna be okay?
That should be enough.
Okay, alrighty, good, thank you.
Somebody said he missed what he said to take if you don't sweat.
Helichrysum. Yeah, helichrysum is really good for decongesting the skin. I treated this lady one time. She wasn't very old. I think she was only like 40. And her legs would balloon up massively. And it was always worst in the summertime. And I started having conversations with her about it, as we were getting ready to treat. And I asked her the sweating thing, and she goes, "Yeah, I'm one of those people who don't sweat. Like I just don't sweat." And I go, "How long have you not sweated?" And she was like, "Since I was a child." And I go, "Well, we need to treat that." And she goes, "No, I'm not a sweater. I just don't sweat." And I go, "No, that's actually a health issue." And she was really tied up on the thing that she had never sweated. And I was like, "It just means you've had this issue since you're a little kid." And, you know, we went back and forth and she was getting kind of annoyed with me. And I had her do the helichrysum baths and that whole mechanism. We had to use some diuretics to get some of the fluid out, but it stopped happening. Like summertime would come and her legs wouldn't puff up. It's a thing. It actually has a medical name to it, but I can never remember what it is. It's just congested skin is what it means. So
I ordered adrenal support and don't know why, how and how to use it, but felt I needed it.
yeah, I mean, you can put just several drops on your wrist daily. It's very good for strengthening the adrenals, so that can offset the effects of stress. It also can just give you a little bit more vitality in your body. It will calm down it will calm down the adrenals a little bit, and it will increase a bit of cortisol in your body, and which is to help like inflammation and things like that. So that's one of those good like maintenance blends that you can just inhale it. You don't even really have to follow a pattern, or you can put several drops of it on your wrist and then just rub your wrist. Yeah, but use it often.
I think you answered this, but any sandalwood for the fluid retention?
Yeah. I mean, honestly, I just use the cheaper sandalwood to do it. I mean, I use sandalwood internally a lot. And so I just use you know, it's not that much cheaper, but it's a little bit cheaper, and, you know, you go through it. So.
Go ahead, Laura.
Hey, Laura.
Hi, Greg.
Hey.
Going back to the adrenal support,
Mhm.
I definitely have cortisol issues going on. Is there anything else besides the adrenal support? That I'm glad I'll order that immediately.
So, okay. So if you have excessive amounts of cortisol, is that what you're talking about?
You know, my cortisol is very high at night.
Okay.
And
so instead of the adrenal support, I would actually use the cortisol reg or the absinthium.
And how would you use it?
Same way, inhale or on the wrist. The cortisol reg, you could put a few drops in water and drink. The absinthium, don't drink.
Great.
Yeah.
And on wrists.
Yeah, like on wrist and inhale, and sometimes it feels really nice. Is take like 4 or 6 drops and then, you know, drop it in your hand and then put a couple pumps, like 3 or 4 pumps of lotion, and then rub it together and rub it all over your abdomen. It's nice, it's relaxing, it calms things down, it helps to reduce the cortisol levels in the body, and it's super soothing. So I would try that as well if you're going to do absinthium.
Now, which one did you say to put on your abdomen?
The absinthium.
Thank you.
And I was gonna say, Laura, I put it in there for in a message
Yeah.
there for you.
Thank you.
Not the abdomen part, but
Yeah, it's really nice, really soothing.
Thanks, Sam.
which oils would you recommend to take orally and for a bath or topical application for someone who has long-term systemic inflammation?
Black cumin. Black cumin. You could go 3 drops a couple of times a day. That would be internal. Systemic inflammation. Then you can make it into a liniment, or you could do the baths. I wouldn't do the baths super hot. I would put like a pound or so of like Epsom salt or regular salt in there, but do it with like German chamomile or yarrow, something, milfoil, something that's super anti-inflammatory. Even blue tansy can be in that realm. It helps the body not to be as reactive and with inflammation. The other thing is I would probably do turmeric, and you could also do frankincense. So we have that black seed complex that has turmeric, black cumin, frankincense, and myrrh in it, and that's what it's for. It's an anti-inflammatory.
I think that answered your question there. Black seed complex is good for inflammation.
Yeah. I can't say enough good things about black cumin. The black seed complex is black cumin with other things, but black cumin is pretty amazing. And the other thing, it's nice. It's super inexpensive for what it does. It's super inexpensive.
For the chlorophyll question, will chlorophyll capsules work?
Yeah, I would say so.
They're pretty like water soluble. Like they're just.
Yeah, Sam says they break down. Sam has worked with chlorophyll a lot more than I have, and so as soon as she saw that, she was nodding her head. I've always taken it in liquid form, but I don't know that there's a difference.
I had a test showing high gut bacteria, excessive undergut micrometabolites, tabolites. What would be good for this?
I would probably start with Palmarosa, like a couple of drops taken internally. After a few weeks, I would continue with the Palmarosa, but start to add a drop or two of spikenard in your internal ingestion.
Same time or separate?
Like at least 5 or 10 minutes apart. Spikenard's a little bit more of a relaxant, so I would say probably that more towards the end of the day. So probably help unwind. But Palmarosa you could just do right off the bat in the morning. It's going to take a little while, but it should change the bacteria in your gut.
Back to the one about the long-term systemic inflammation. How long would they be under that black seed?
Depends on how quickly you respond to treatment. There's not really a set way. A lot of times I have the person doing it until the inflammation has changed a bit. I mean, the issue could also be excessive amounts of cortisol in the body as well, like we were talking about with Laura. And so, I would treat for a good 30 to 60 days and then bring it to our attention again, and then we can augment treatment. You'll probably stay on that for quite a while though. Like you can tell when your body has inflammation or excessive amounts of cortisol, your muscle tone starts to break down. That's a really big one. Your tissues start to break down a bit. And so it could just be from inflammation, but usually high levels of cortisol are there as well. Cortisol is just a stress hormone. It's good when you're trying to fight inflammation in the body, but then when there's too much, it actually starts to do the opposite. Okay, so with this, boy, that was a good Q&A session, by the way. Let's break into the brain waves. And we'll start with Delta. So if you have the brainwave kit, you can use Delta. If not, here are some choices: Artemisia, bergamot, mugwort, petitgrain, rue, or tarragon.
Delta's the A+ choice.
Delta is A+. Begin inhaling. Your awareness is on your throat. Yeah. Keep inhaling. Your awareness is on your throat. Move down to the bottom of your throat, the throat minor. Now go to your back throat. This one, not really. Like they don't have any of the choices. Move your awareness to the jaws. I mean, this is a long shot, large G. There's really not a lot. Your awareness are on your jaws, where they hinge in front of the ears. Move to the temples. Move your awareness to the back head. Your awareness is on the back head. Move your awareness to the forehead. Awareness is on your forehead. Just be still, be aware. Notice how you feel. Now we're going to move to the Theta oil. So Theta is the A+ choice. You could also use Splendor. Cape Snowbush, Poplar Balsam, also Galbanum, Anula, Blue Tansy, I think you might be it there. So let's see if you have some of those. Okay. So again, begin inhaling. Your awareness is on the throat. The bottom of your throat. Go to your back throat, the middle of the back of your neck. Your jaws. Move your awareness to the temples. Go to the back of the head. Your awareness is on the back head. Move your awareness to the forehead. Just be still, be aware. Okay, we're going to go to the next one, alpha. Traces are the alpha blend, but also basil, any form of basil, mastic, valerian, spikenard, vetiver. And the B choice here would even just be good old fashioned lavender. The storage unit's all sealed up. The storage unit's all sealed up.
Mhm.
Okay, begin inhaling. Your awareness is on your throat. Move your awareness to the throat minor, the bottom of your throat. Move to the back of your throat, the middle of the back of your neck. Keep inhaling with your awareness on the back throat. Move your awareness to the jaws, where they hinge in front of the ears. Move your awareness to the jaws, where they hinge in front of the ears. Move your awareness to the temples. Move your awareness to the back head. Your awareness is on your forehead. Awareness is on your forehead. You're taking long, slow, deep breaths. Excuse me. Just be still, be aware, just let go. Okay, we're going to look now for our oils for beta. So the beta blend, marjoram, terebinth, pine, or Roman chamomile. Begin inhaling, your awareness is on the throat. Down to the throat minor. Your awareness is on the bottom of your throat. You're taking long, slow, deep breaths. Your back throat, the middle of the back of your neck. Move your awareness to the jaws, where they hinge in front of the ears. Move to the temples. Continue to inhale. Your awareness is on the temples. Move your awareness to the back head. Your awareness is on your back head. Awareness is on your forehead. Awareness is on your forehead. Just let go. Just be still. Okay, we're going to do gamma waves. So gamma is the A plus, but also A choices are acacia, frankincense, any sort of clary sage, or sage. Begin inhaling. Long, slow, deep breaths. Your awareness is on your throat. Move down to the bottom of your throat, the throat minor. Move to the back of your throat, the middle of the back of your neck. Go to your jaws, where they hinge. Move your awareness to your temples. Your awareness is on your temples. Move your awareness to the back head. Your awareness is on the back head. Your forehead. Your awareness is on your forehead. Your awareness is on your forehead, where the hairline is. Just be still, be aware, just completely let go. So notice how you feel. Notice your body, your emotions, your mind. What we just did does two things, really. It's two sides of the same coin. One is it helps to physicalize divine energy into the body. And then the flip side of that is it helps to reduce what we would call psychosomatic issues. You know, physicalizing things that are stressful or negative or emotionally charged. We all have the mechanism in us, but depending on how agitated it is, it either is physicalizing divine or physicalizing positive or the negative. So how do you guys feel? I have enough time for a few feedbacks.
And you can unmute yourself.
Yeah, unmute or type in.
Yeah, or type in. Yeah, go ahead, Trace. We can't hear you.
Hello, can you hear me now?
Yeah.
Okay, it wasn't letting me unmute.
Oh, thanks for letting me know.
So
Hi,
I feel
guys.
a little sad. Is that, I didn't feel sad earlier. Now I feel sad.
It could be something that you're processing, you know, not necessarily in your conscious mind. I mean, that's not the goal, but it can happen.
Okay.
You know, if you think about it, like when you go through and you process things, you're not stuffing them down, or they're not physicalizing. And so sometimes psychosomatic is just simply not addressing and processing things that have happened. And so, you know, given everything that you've been through in the last couple of years, that you feel a little bit of sad, I'd be a little concerned if you weren't sad. I mean, to be honest with you, like, I mean, that was a rough 2 years or whatever it was, that you're a little bit of sad about the family dynamic. Yeah, it's something to be sad about, you know. I don't think you have to dwell in it, but just like kind of sit with that sadness and the feeling, and it usually passes very, very quickly.
Okay. My
Like
my
minutes.
sinuses did start to let go.
Did they really?
Yeah.
Yeah. I mean, it could be the stress of managing those feelings. I mean, that's always a potential. Yeah. I mean, there's times where something that comes up lasts for like maybe a day or two or something. I think in a really extreme case, it's been like a week for me. But usually it's minutes. Like if you sit with the feeling, it will usually pass in minutes.
Will do. Thank you.
Yeah. Keep your awareness on your heart though.
Okay.
And I did just make it so you guys can unmute. Someone said, I presume it's important to do the whole series?
Yeah.
And in that order?
That order, that series. If you change it up, it does other things. So.
Go ahead, Carol.
Hey, Carol.
Hi, Greg. My husband came down while I was doing the inhalations, and he put on the light, and I screamed and screamed and screamed and screamed and screamed. Is that because of, I just kept screaming, and then he started
I would say that's something that happened in your past. Yeah.
But this oil brought it up.
It is trying to release it from the body. And so it usually only lasts for like a minute or two, like sometimes maybe 5 minutes. But like, even if that stirs a feeling, if you just sit with it, it's something that has been physicalized into the body. You know, it's like the body's letting it go.
Well, because I've never done that before. It was just,
Yeah.
I do that if I see a spider, but I've never, it was just so weird. So should I do this protocol again? Get that
I'd
out?
give yourself like a day or two, and then maybe in a couple of days do it again. But
Okay.
a lot of times when you go through and you do it again, it's not the same thing comes up.
All right.
I mean, it can be, but most times it's not.
Okay. Thank you.
You're so welcome. Carol, I'm just curious, how do you feel right now?
I'm a bit shaky. I feel like
Yeah.
just a little bit vulnerable.
Right. I would say that's probably tied to the incident, and just sit with your awareness on your heart. And if you want, this would go for Tracy as well, is when something like this comes up, you sit and keep your awareness on your heart, and you don't even have to think about anything or visualize anything. Just inhale and breathe in helichrysum. You don't have helichrysum like poplar or milfoil or yarrow or something, but helichrysum would be the first choice because it helps you move past the event.
Right. Yeah, I have helichrysum. Thank you.
Yeah.
I don't know who was first, Megan or Letty, either. All right, I guess I'll try Megan.
Hey there. I have a hard time understanding physicalized emotional energy. I compare it to, like, I know that we have like Velcro and some things stick. I know some things are like deep. I guess just because personal experience here lately, like we talked about, I think last week, I had an experience where it was just like a bunch of physicalized energy, but it wasn't, I couldn't like cognitively understand it. And I guess that's still happening. I guess I'm a little confused. I don't know if my question is
I think the easiest way to think of somaticized energy or psychosomatic mechanisms is basically your body's holding on to it so you don't have to process it emotionally or mentally. The difficulty with that is that it still feels like it's happening to a certain degree. Like that event is still happening. So the reason to get those things out is so that you are literally letting go of the past. You know, this combined with some of the stuff in the sleep mechanism class and is really good about just fleshing out things from the past. Yeah.
okay.
Yeah.
So my body's basically taking it on, so it didn't get to the mental or the physical aspect.
Right. Part of how we would like not process, go into automatic behavior, you know, repress it, you know, there's slightly different mechanisms. Repressing is actually a little bit of a different mechanism because there's more conscious choice. But basically the body clamps down on the energy of it and some of the neurological impulses and things to keep you from having to process it. I mean, basically is what it's doing. And so as you let it out, it actually starts to help you feel better emotionally, mentally, but it starts to change actually your physiology.
Okay, thank you.
You're so.
It's a minute till.
Let's fit Letty in.
Go ahead, Letty.
Greg, sorry, I was just wanting to ask real quick if you were looking for the muscle memory or body memory for Kathy. Is that the one you were?
It was. Yes. Yeah.
Okay, so it is hyssop and frankincense, and then you do want me to look for the pattern and post it real quick, or
maybe we'll post it on Q&A because I'm going to have to jump into another meeting.
I'll get it to you.
Yeah. But
Okay.
we'll get it out to her. Perfect.
Okay, so it's the muscle memory and it's in the wisdom of the heart class.
Yeah, I knew it was in some like one of the classes, but not something you would normally think of. Yeah.
Yeah,
Good.
and then I was just wondering really quick about the autobiographical for maybe for Megan.
Actually,
Memory?
the segment before where it's the episodic memory,
Mhm.
like that set of protocols.
Okay,
that-
okay.
yeah.
Okay,
You're right on it.
okay. Alrighty, thank you. Sorry about that.
You're so welcome.
Right, thanks guys for joining us.
Love you guys. I'll talk to you some tomorrow night and some on the weekend and some next week.
Thank you.
Take care, you guys.
Thank you.